Hello, this is Katie Owens with the Healthcare Experience Foundation. I am so excited to share more with you about our upcoming teaming with the Maryland Healthcare Education Institute to support your patient experience strategies through elevating your practice and process with how we as leaders round on our patients. In just a few moments, I'm going to share with you a little bit more about our upcoming programs and how they'll support your success in April and May. So you might ask, what's different? We have been working on talking about patient rounding for the better part of the last decade or longer. The challenge that we see is that oftentimes our efforts are not equaling our outcomes, and we have found at the Healthcare Experience Foundation a better way to optimize your rounding so that we move beyond the effort to building meaningful relationships in a way where we are aligning our patient experience strategies, validating our performance, and coaching our team up to be successful. So we have designed this session in partnership with MHEI for leaders who are currently doing patient rounding but are incredibly frustrated with the results. For leaders who are rounding but not getting meaningful feedback, so we're getting the everything's A-okay and fine, but then there's a disconnect when we see our patient experience survey performance results. When our outcomes are not matching the effort, when we feel like our team is doing better than our performance is reflective of. For those leaders who are looking to take their patient rounding up a notch, or for those who are just getting started with patient rounding, or new to a leadership position, all leaders will receive and build an actionable plan to use immediately back on site in your organization with time-bound activities. So this is a meaningful, meaty session where we're going to be doing active skill building, and you're going to be going back to your organizations to apply. What we have seen in our work with hundreds of organizations is that patient rounding, when done well and consistently, can create the glue for your patient experience outcomes. In many organizations we work with, when patients can say a leader rounded on them, it greatly influences their perceptions of the consistency of care, their likelihood to say that that hospital or that clinic or that emergency department was the best possible place to receive care, and their willingness to recommend. And so when we look at this path that we are building with MHEI, over the next several weeks is your time to register for this session. All participants will be assigned some pre-work so that our faculty will be able to help you with your personalized plan. Our first introductory session is scheduled for April 3rd at the MHEI office. From there, all participants will be working on action steps and some time-bound milestones. And then there's the option for the mastery class, which will be held in May, also at the MHEI office. So just to show you how we're going to be layering the learning between April and May, we're going to do some welcome and team building. This is going to be a high-energy learning environment. We're going to look at visioning for excellence and your authentic communication strategy that will help you be successful with patient rounding. Understand the difference between rounding as a task and high impact practice and process that allows us to build relationships with patients and obtain meaningful feedback to help us improve on our path towards excellence. You're going to build your communication and rounding inquiry, and we'll work with you depending on the type of rounding that you're doing, whether you're using an app or a survey tool or a rounding log or another method. We're going to make sure that you have your own path. We're going to do a lot of practice and simulations, and then going forward, you're going to receive a Cascade Learning toolkit and some time-bound goals for your application of the learning. The mastery class is going to build on the work of the first class. What we like to do is never assume that when we've spent time developmentally with leaders, that they can immediately go out and apply and be successful. And so this session allows us to focus on skills for leadership agility to support your patient experience strategy, mastering the high impact process that yields results with patient rounding. Your role as coach, when we do rounding well, we obtain feedback that is important for us to share with our peers, our staff, and physicians. Sometimes that's great feedback, and sometimes we have to manage conflict. Which leads us into how, when we're rounding well, we're finding out the times that we're not always, supporting you with service recovery strategies and conflict management solutions with both patients, families, and of course, interprofessionally with our teams. We're going to get into more intensive practices and simulations and look at competency validations. And then going forward, layering on top of your action plan and creating some accountability for improvement. So by the end of sessions 1 and 2, we want you to have a clear understanding of your personal why for patient experience and authentic style for rounding on patients. You're going to experience layered learning skills for patient rounding that we can attest achieve results. You'll have perspective on new communication strategies to both engage with patients and employees and physicians. And you'll have a personalized approach to patient rounding and a clear picture of your next steps to be successful. We're excited to bring you an incredible faculty from Katrina Coleman, who you know and love at MHEI, our Brooke Billingsley, Vice President of Service Excellence at the Healthcare Experience Foundation, Kathleen Lynham, nurse leader extraordinaire, who serves as an executive coach and senior leader advisor for our team, and myself, the president and co-founder of the Healthcare Experience Foundation. We hope to see you for sessions 1 and 2. For more information on how to register, you can visit MHEI's website or personally contact Kelly Yost. We are excited to be a part of your success in skill building on one of the most rewarding competencies that we see leaders can achieve results with, how we as leaders connect and round with our patients. Hope to see you soon.